Hi, I'm Dr. Rick Hershberger, one of the vascular surgeons at Sarasota Vascular Specialists. Today I'm here to talk about a very serious situation called critical limb ischemia. What that means is that the foot has so little blood flow that if we don't do a procedure, patients will wind up with an amputation, either a toe, a foot, or worst case scenarios, part of the leg. Typically, if you have critical limb ischemia from a vascular cause, you have severe aggressive vascular disease in the leg. What I have drawn here is the normal circulation to the leg. Up here represents the groin. This is the knee. There's one artery that brings direct blood flow down below the knee into three arteries that branch into the foot itself. Everyone's born with these three arteries, but it tends that in patients with critical limb ischemia, severe vascular disease, they lose all or part of these arteries. The typical rule is that you have disease at multiple levels throughout this system. Sometimes you can even lose an entire artery in this process, parts of an artery in various locations. Options for treating this depends on where these blockages are because they can happen at all levels throughout the blood flow. Sometimes we can get a wire and catheter, put a stent in an artery here, balloon an artery here, and now we have blood flow that goes back into the foot that could heal a wound or prevent you from having pain in the foot at night. Sometimes the disease is so severe that the entirety of the blood flow is lost to the leg, such that there's only an artery down in the calf. In this case, this segment is too long to do a stent, and we have to do a surgery bypass where we take either your own vein or a piece of plastic tubing and reroute the blood flow, starting in the groin and going all the way down to the calf muscle. Once again, bringing that blood flow to the foot, and those are the only two reasons that we would do an intervention this aggressive, because these bypass surgeries on average take about 6 hours. The result is if you have a wound to the foot or you have pain in the foot from lack of blood flow, we get you out of that risk of limb loss and hopefully get you back to a lifestyle in which you're walking. Peripheral vascular disease can have very severe consequences, so severe you can be at risk of losing your leg. We do have solutions, both with stents and wires, as well as surgical bypasses, to get you out of that situation where you're in your limb loss. Thank you for watching another Whiteboard Wednesday.